Comprehensive assessment of Domain 12. Other significant care needs in CHC assessment. Drains. What type of drain is in place, and what is its primary purpose, e.g., surgical, peritoneal, chest drain? How frequently does the drain need to be monitored? Emptied or replaced? Are there any complications such as infection, leakage, or blockage? Does the individual require assistance with drain care or management? What specialist support is needed to maintain and monitor the drain, e.g., surgical? Team district nurse? Dialysis. What type of dialysis is the individual receiving? Hemodialysis or peritoneal dialysis? How frequently does the individual require dialysis, and where is it performed, home or hospital? Are there any complications related to dialysis, such as infections, clotting, or low blood pressure? What impact does dialysis have on the individual's daily life, mobility, and energy levels? Does the individual require additional support for transport, catheter care, or dietary restrictions? Hypersalivation. Does the individual experience excessive saliva production? And how does it impact daily life? Is the individual at risk of choking or aspiration due to hypersalivation? What treatments or interventions have been attempted, e.g., medication, surgery, suction devices? How frequently does the individual require suctioning or other management strategies? Does hypersalivation contribute to other complications such as infections or skin irritation? Autonomic dysreflexia. Does the individual have a spinal cord injury above T6, increasing the risk of autonomic dysreflexia? What are the known triggers for autonomic dysreflexia in this individual, e.g., bowel care, pressure ulcers, catheter issues? How frequently does the individual experience episodes of autonomic dysreflexia? What interventions are in place to prevent and manage autonomic dysreflexia? Does the individual require specialist input from a neurologist or spinal injury specialist? Regular blood transfusion. How frequently does the individual require blood transfusions, and what condition necessitates them? Are there any complications related to transfusions, such as iron overload or allergic reactions? What monitoring is required before, during, and after transfusions? How does the need for regular transfusions impact the individual's quality of life and daily routine? What specialist input is required for blood transfusion management, e.g., hematologist, transfusion nurse? Poikilothermia. Does the individual have a spinal cord injury above T6 that affects temperature regulation? How frequently does the individual experience temperature fluctuations, hypothermia, hyperthermia? What measures are in place to prevent exposure-related complications? Is there difficulty in obtaining accurate oxygen saturation readings due to poikilothermia? What specialist input is required for temperature regulation and related complications? Specialist involvement. Which specialists are involved in the individual's care, e.g., nephrologist, neurologist, hematologist? How frequently does the individual require specialist reviews or interventions? Is there a multidisciplinary team coordinating care across different specialities? Are there any challenges in accessing specialist care or treatment? What ongoing assessments are required to monitor the individual's condition and treatment effectiveness? Please share your thoughts in the comment section below.